Hey Clay, I'm Jake. I'm the PA student. Going to be doing your heart, lung, and abdomen exam. I'm going to go ahead and wash my hands, and you can just put on the gown with the opening to the back, please. All right, I'm going to have you lay back at 30 degrees. And if you could just turn your head to your left, I'm noting any jugular venous distension, and then you can look forward for me. I'm assessing your carotid pulses for any bilateral pulsations, and then I'm going to palpate your carotid pulse one at a time. All right, if you could hold your breath for me. I'm gonna listen for any brewery. All right, let's go ahead and pull the front of your gown down for me. Now I'm gonna look for PMI and any ventricular movements, and then I'm gonna palpate for any heaves and lifts. Okay, palpate for thrills. Okay. Pulse here. Actually, I'm gonna have you lay on your left side and locate your apical pulse. And I'm feeling for location, duration, amplitude, and diameter. All right, I'm just gonna take a quick listen. All right, I'm gonna have you lay on your left side right quick so I can further assess for mitral stenosis. Okay, I'm gonna have you sit up and lean forward and fully exhale for me. All right, thank you. And that was to further assess for aortic regurgitation. So now I'm gonna have you pull your gown all the way down so I can expose your anterior chest, lateral thorax, and posterior thorax. I'm noting your rate, rhythm, depth, and ease of breathing. And I'm noticing the chest for shape, movement, deformities, intercostal retraction, and accessory muscle use, as well as any skin mat rallies. Anterior, lateral, posterior. I'm doing a general palpation for any crepitus, tenderness, or masses. Hands on your hips for me. All right. Okay. You do a deep breath for me. Okay. All right, say 99.
99, 99, 99, 99, 99,
Hands on your hips.
99, 99,
Go ahead and cross your arms for me.
99, 99, 99, 99, 99.
All right, great. Put your hands on your hips, sorry. All right. Go ahead and cross your arms. All right. Go ahead and breathe normally for me. I'm going to estimate both hemidiaphragmatic. What is it? Excursion?
Hemidiaphragms. Yeah.
Hemidiaphragms, yeah. All right, go ahead and exhale completely for me. Mark. Inhale. Hold it. Mark. Okay, great. I'm going to take a quick listen.
Just verbalize, he'll do the other one.
Oh, yeah. And then I'm just breathe normally for me. I'm going to take a quick listen, but first, can you cough and try to breathe with your mouth open, okay? cross your arms for me. If I hear any abnormal breath sounds, I'm going to do one of the 3 tests where I've heard the abnormality. If I'm hearing for egophony, I would ask the patient to say E, and I would hear A. If I'm listening for bronchophony, I would ask them to say 99. If it's loud and present, then it's bronchophony is present, and then whispered pectiliqui, I would ask them to say 99. And if it's clear and distinct, then whispered pectiliqui is present. Okay. If you need to empty your bladder, I want you to go ahead and do that. And then I'll have you lay on your back. With your feet up. I'm going to expose xiphoid process to symphysis pubis. And then I'm going to assess the abdomen for any rashes, scars, striae, venous patterns. I'm going to assess the contour of the abdomen for distension, bulging, or masses. And then I'm going to look for any peristaltic movements or any pulsations. Can you point to where you're experiencing any pain for me, Clay? Okay, great. I'm just going to take a quick listen to your intestines very quick. Okay. Listen to your aorta. Renal, iliac. I'm going to palpate the femoral artery with the gloved hand, and then I'm going to listen as well. Okay, I'm just going to measure your liver right quick, or estimate your liver. And now I'm going to estimate the location of your spleen. Okay. All right, Clay, can you point to me one more time wherever the pain you feel? Okay, great. Light. 4. Muscle tenderness, or muscle resistance, tenderness, or superficial masses. And I'm going to do deep palpation for any tenderness or masses. Okay, take a deep breath for me. Feel the edge of the liver. Okay, you can release. Take another deep breath for me. Feel for the spleen. Okay. Capture the kidney. Okay. Then I guess I would go on the other side of the patient to do the other kidney. And
Just make sure you have deep breath.
Deep breath. Hold
in, and then like as they exhale, you're supposed to feel it slip back into place.
it. Okay. Deep breath in, exhale. Okay. I'm going to palpate for the abdominal aorta. Measure the distance. All right, go ahead and sit up for me. All right. Thanks, dude.
No problem.